Welcome to Cock Talk. My name is Lily, and today we're talking about ACT or ACT. I'm here with
Angel.
And Taya.
And we're going to start off with an icebreaker, talking about just things that we like about ACT. I think that it's really cool. I mean, based on what we've learned so far, is kind of looking if you have an issue or a problem, kind of taking it out of yourself and looking at it in a different perspective.
Yeah, I think that's also something I like a lot of aspects of ACT. I really like the idea of not sugarcoating the fact that life sucks sometimes, and so you just kind of have to accept that and learn to make the best of it. And I don't know, I like that idea. I like the idea of being motivated by a specific value and what matters to you rather than maybe other expectations.
Yeah, definitely.
I really like its flexibility. In my section, I read about it being either really structured depending on the needs of the clients or very person centered, again based on the needs of the clients. And I don't know, it's a really nice in between compared to the CBT and DBT that we've talked about earlier. It's a nice really flexible plan. That's one of my favorite aspects about it, at least.
Yeah, I agree. Okay, so I guess we can just hop right in. As Lily just mentioned, ACT, stands for Acceptance and Commitment Theory, and it is a little different from the previous theories we've talked about because instead of saying it ACT, it's typically pronounced ACT, which is different from DBT or CBT, which we don't pronounce just straight up, which is interesting.
But yeah, no, that doesn't make sense.
Yeah.
DBT.
So this is still a cognitive theory. It is in the third wave. ACT was created by Professor Stephen C. Hayes in the mid-1980s, then further developed by Hayes's colleagues Kelly Wilson and Kirk Strosahl. I'm hoping I said that right, but I might not have. It evolved from behavioral analysis and is based upon a theory known as relational frame theory. As you know, there are many subclasses of behaviorism. I mean, I guess I shouldn't say as we know if you don't know anything about psychology, but as we know here at the desk. ACT stems from one of the subclasses called functional contextualism, which is a theory basically just based around people's thoughts and feelings. It's very integrated with thoughts and feelings and behavioralism. Okay, so moving on from the history, do you guys have any questions or anything to contribute before I segue? Okay, perfect. ACT, like I kind of mentioned before, appeals to me personally because of the overarching concept that life inevitably includes pain. As someone who can't stand toxic positivity, I find this very real, but also still hopeful. It almost kind of reminds me of existentialism in a way because of the idea that we kind of create our own meaning and we have to be authentic to our true selves. I really just like those ideas. Okay, so ACT argues that life is inherently difficult, like I previously mentioned, but that the human condition tends to make it even more difficult. So then through the use of ACT, a person is able to learn skills to help people live meaningful lives despite the pain. ACT helps people accept painful thoughts and feelings, commit to actions which are guided by personal values, and ultimately build a meaningful life despite distress. Interestingly enough, ACT is a non-linear model of therapy, which is kind of what Angel mentioned before. It gives the therapist a lot of flexibility. At any point in any session, if a roadblock is hit with one process, you can switch to one of the other core processes and come back to the other when the time is right. The goal of ACT is psychological flexibility. What psychological flexibility means is being present, opening up to thoughts and feelings, and doing what matters in context of personal values. We will probably get into this a little deeper, but psychological flexibility is made up of 6 core processes, usually pictured within the hexaflex. These 6 core processes are contact with the present moment, which means to be here now, paying attention to what's happening in the current moment. Diffusion, which means to step back from your current thinking and detach yourself from thoughts rather than fusing and becoming one with them. Acceptance, meaning to open up and make room for unwanted private experiences. Instead of running or fighting these thoughts and feelings, we allow them to flow through us. Self as context, or the noticing self, is to be aware of what we may be thinking or feeling in the moment. Values is to know what matters to you individually and what you want to be and do, the compass of your life, you might say. Committed action is doing what it takes, such as goal setting, problem solving, action planning, etc., the steps that we take to actually move towards those values. And then there is a simplified model of the hexaflex that we kind of like mentioned what they are, but it makes up of like, it's a triflex consisting of being present or like mindfulness, opening up, which is acceptance and diffusion, and doing what matters, which is values and actions. Do we have any? So it's a lot of information. Anything, any questions or anything like that?
I just think in general with the psychological flexibility, I mean the flexibility within moving throughout the triangle and then also the hexaflex, all the different areas. I think that's just really useful in therapy, because if there's a client and they get stuck in like a roadblock, like you said, I think that's really, I mean, I really resonate with that, because if you have like an issue and you don't know how to get past it, maybe moving to a different area can help you with that other issue that you're having.
Almost giving you like a new perspective.
Yeah, and I think that that's something that we've seen with with CBT and DBT. I mean, you can always have flexibility as a therapist, but this model specifically looks at that, and I think that's a great way to be with people, because everyone's different. One client can change within a week at the next session, so.
It almost like encourages the flexibility rather than like other theories like CBT that like wants you to be more structured and more strict almost.
Definitely.
And kind of going off of that, I feel like it just promotes more just client autonomy, and like just kind of letting the clients be themselves and like really kind of decide what they want to work on as well.
I think that's a great point.
Yeah, which could really help. Which is kind of also in line with what you said earlier about existentialism, the existential theories, and how that kind of, I don't know, I saw a lot of similarities with ACT and the existential theory.
Yeah.
That was really kind of surprising in my eyes, and this is one of those that kind of came to mind.
I think that I didn't even like really think about that while I was like typing up my notes for this, but I think that's a great point of like client autonomy, especially if you start getting into something and then the client, I know I've been that client that's like, actually I might not be ready to continue down this path. So then to be able to have that flexibility of backing up and going down a new road, I think is really powerful for the client as well. So thank you for that. Another model I just want to touch on a little bit is the choice point model. This tool can be used at any moment. A short description of it, I really like this model as well, is that you kind of have, at all times you have two options. And you have away moves, which are movements that you're making that take you away from your values that you want to pursue, and your towards moves, which bring you closer to the values that you want to move towards, I guess. Sorry, that's why that's towards moves. Sorry, I got a little tongue-tied. And so each time when you're brought up to a choice in life of what you're about to do, you kind of can make that decision if you're going to do an away move or a towards move. And so the thought behind this is that difficult thoughts and feelings often hook people into away moves. So using this tool can ultimately help clients unhook, reduce away moves, and increase towards moves. So that's kind of all I wanted to touch on that. There is deeper things about it. But really the overall purpose of ACT is to teach how to live with the inevitable pain that living life brings. So Lilly, if you want to take it away from there.
Yeah, so we're kind of like shifting into like a little bit what happens in the session between a client and the counselor. Therapists talk about their clients getting hooked, which is when thoughts or feelings take control over behavior. Our thoughts and feelings hook us. They hook our attention, reel us in, jerk us around, and pull us off track. Now the client is no longer having a thought or a feeling, they are caught up in it. Getting hooked incorporates both fusion and experiential avoidance. Cognitive fusion is when we get so caught up in our thoughts that they dominate our actions and overshadow other important sources of information. We often treat our thoughts as literal truths instead of just thoughts. Experiential avoidance is the attempt to control or suppress internal experiences like thoughts, feelings, or memories, and this can cause harm. From a young age, we're taught that uncomfortable feelings are problems to fix. Common phrases, you guys have probably heard this as kids, like don't cry or don't be afraid. And this suggests to young minds that emotions themselves are dangerous and must be controlled. So that's kind of a social norm that I think kind of gets put on young children and people in general. However, the more we try to control or eliminate these experiences, the more power they gain, which can drive us into rigid patterns of behavior. And cognitive diffusion is a key reason why psychological flexibility is even a thing. So I have a little example that our listeners can do with us, and you guys as well. So say I'm the therapist and you're the clients in the setting. Imagine for a moment that your hands are your thoughts and feelings. Look around you and imagine what you see represents everything that's important in your life. Then hold your hands together, palms open, like pages in a book, an open book. Then slowly and steadily bring them towards your face and cover your eyes and cover your face. And take a few seconds to put your fingers, like open your fingers so you can see through your fingers. And notice how this affects your view of the world. So, what would it be like going around all day with your hands covering your eyes like this?
Probably running into a lot of things. Very blinded.
Yeah. How much would it limit you?
A lot. I feel like you miss just a lot of things.
Yeah. If you can like kind of see like maybe 50%, maybe even 40, 30%. Yeah, really, you can't see. How much would you miss out on?
Too much.
Yeah, a lot more than I'd want to.
And some other questions to ask, how would it reduce your ability to respond to the world around you?
You only really have 50 at most percent of information coming in and making like heavy decisions based off of that 50, but without really, literally not being able to see the full picture.
Yeah, definitely. So this is what I mean by getting hooked. We get so caught up in our thoughts and feelings that we miss out on life and we can't act effectively. So this is when we fuse a cognition. So when our thoughts and feelings are close, it can seem like something we have to obey, give into, or act upon. It can seem like a threat we need to avoid or get rid of, or something very important that requires all of our attention. So we're gonna do it kind of again, but a little bit differently. So now cover your eyes with your hands again, but this time take them away or lower them from your face really slowly. And as the distance between your hands and your face increases, notice how much easier it is to connect with the world around you. This is what I call unhooking. How much easier is it now to take effective action? How much more information can you take in? What do you guys think?
A lot more.
Yeah.
I mean, like, you don't have those barriers. It's easier to react when you see a lot more of the picture.
Yeah, and when your thoughts and feelings aren't so in your space, when they're out in front of you, you can see a lot more.
And it's not like you're minimizing them, it's more like you're not really letting them kind of...
It's like you're stepping away.
Yeah. They're not controlling you.
Yeah, exactly. That's what
And you're more connected with the world. So when we diffuse from that cognition, we can see it for what it is, a group of words or pictures inside our head. We can recognize that it is not something we have to obey, give into, or act upon. We can recognize that it is definitely not a threat to us and may or may not be important. We have a choice as to how much attention we pay it. So this is something I think is helpful for people to kind of really visualize the difference with fusion and diffusion and how our thoughts and feelings can play into our lives. So
I especially like the word of like choice and like giving that, like, I think that just gives that power to, I mean, I was about to say the client, but really anyone having that power to make that decision that you're not, even though maybe your life circumstances are inevitable, you still have power in the situation. And
yeah,
I like that.
Yeah, having power, and it definitely is client empowerment in that way.
And I feel like just having knowledge in these concepts of just ACT in general could also just help us as counselors practice things like unhooking. That way when we show up to a client, we're not kind of like clouded, and we see more of like the bigger picture to be in a better space to help them. Even if we don't practice ACT directly, at least like having these concepts and ideas in mind would, at least in my eyes, kind of help us just be in a better headspace to be more present with the client as well.
Yeah, and I think that also like can create safety, and you're like creating that like really therapeutic environment when the client has that space where the therapist is calm. I think that really does create safety, and also like the ability for the therapeutic alliance to create trust and build trust. Yeah.
That's perfect.
Yeah. So if ACT is about helping people unhook from their thoughts and create space to act on what matters, the question becomes, how do we actually do that with clients? And that's where things like building rapport, obtaining informed consent, and using ACT in a flexible, client-centered way come in.
Perfect. Okay, cool. So for my section, I was covering chapter 5, which is setting up for success. So a lot of this chapter kind of covered the goal of like the first session or sessions of therapy, especially in this ACT framework. A lot of the goals involve like establishing rapport, obtaining informed consent, taking a history of the client, establishing behavior goals, doing these last two is usually asked for a little bit more like time, and then which is being doing a brief experiential exercise and then giving some simple homework. So I'll focus on some of the more other important ones. So establishing rapport. This is kind of like being fully present and approaching the client with openness, compassion, and curiosity. So one aspect of the book kind of highlighted was if you see the person as a rainbow or a roadblock. I thought that was kind of like an interesting view of looking at the client. So it would kind of invite the counselor to reflect on how they view the client and to appreciate the client's uniqueness. How do you guys feel like you'd be able to kind of do with that?
I definitely think it's also like the collaborative approach, especially just really like being open-minded that every client has their own uniqueness, and I really think that with ACT, it's really about the collaborative relationship and really talking about what the client wants also and being at that same level.
Mm-hmm.
I like it, especially because I think it like lends a lot to like the whole flexibility idea of ACT, and like being able to be open and flexible with each client and viewing them as like a rainbow and as like unique compared to maybe you've had past clients who may have a very similar like presenting concern, but that doesn't mean that they're going to be like going through it the same way or reacting to it the same way. And so just looking at it like through a new lens each time.
Yeah. My personal favorite one was the two mountains metaphor though. It was where it kind of welcomes this aspect of us not being someone that knows the answer to everything and that knows everything, because I feel like that's kind of a preconceived notion a lot of clients might have on the counselor's part, and that we are each climbing our own mountains and that we each have different perspectives. That like I could see the client being like, or the client's mind be like, hey, maybe if you go this way you can make things a little bit easier. And to me it was really reminiscent of the kind of like fellow travelers concept that was like really heavy in existential therapy. And I personally really liked it. And they established to be authentic, to show up as your personal self because you are a person as well as a counselor. So to me, I just really kind of appreciated that aspect that ACT kind of focuses on for establishing rapport.
Yeah, I think I too like it. However, I feel like part of me is like kind of resistant to the specific metaphor. Not because there's anything wrong with it, but I think just because of like the way my brain like immediately like thinks about like, I don't know, it's intimidating to me because I'm like, well then what if like putting that metaphor forward, they're wanting to then get me to self-disclose more so that they can like help view my situations from their mouth, you know? And so like I feel like intimidated by that and like keeping it on track that I'm there to like support them, which is why I find myself liking, I think, the fellow travelers idea more than the,
Mhm.
but I think both are like good. The mountain one just kind of intimidates me, and I think I would need like a lot of practice in using it before trying
that's
it.
completely fair, honestly. I can see that.
I think it also depends on like the client and like what their intention is with therapy and also the relationship. So it's like starting out, obviously, I think like that metaphor and bringing yourself in, you can just kind of like hold back a little bit because you don't want to self-disclose too much. But I think also it's really helpful if a client views a therapist like, oh, like I'm not the only crazy one. Like
Yeah.
this person is also like a human. Like even
Yeah.
though that they don't have to say every little detail about themselves, like the client or the counselor, I feel like the client can feel like, oh, okay, this is a safe space where I can actually talk about whatever is
Mhm.
bothering me. And so
No, I
there's
definitely
like balance. I definitely
agree
think
with like the humanizing aspect of it.
yeah.
I just, I don't know, I get like nervous. I think maybe it's just like my mind automatically going to be like, well, what if they then think, oh, well, then I'll just talk to like someone else. What's the point of therapy if someone else, like I just like, I start to get anxious. And
Understandable.
yeah, but I don't know, I think that it is a very interesting report, and I think that it provides really good perspective, and like the humanizing factor is a really big deal.
Yeah.
Yeah.
So next we have the obtaining informed consent. I was kind of not confused, but a little surprised as to how this one is like really kind of direct for ACT, because it's like the book at least suggests kind of like just being upfront about everything that's expected, and like I think they said that telling the client that you get what you put in is kind of like an expected way to kind of form it, because like you said, it's really collaborative. It's a very active form of therapy, and that's kind of working together as a team and learning skills like unhooking and clarifying values and beliefs, and maybe even creating like action plans. That could be a lot to ask of someone, so to kind of be upfront about what it looks like, so that way the client isn't really blindsided or surprised by the more kind of active aspects of ACT. The book at least emphasized that it's like a really important way to kind of start off sessions.
I really
before getting into it.
like it too. I think that it's like a more collaborative way to do like agenda setting that we saw in like CBT. I just think like, I don't know, I mean it's all up front and just like kind of putting your expectations, especially if it's someone who's new to therapy,
Mhm.
like putting those expectations up front about what you as the counselor expect from them, but what they also should expect from you. I think that I really appreciate the transparency.
Yeah, I like the directness as well. Like you can like be collaborative for everything else, but this is something that's like, let's talk about what it even is
Mm-hmm.
and what it entails.
Yeah, there was even one kind of skill that was brought up in the book called the press pause metaphor. I know we talked about this in class a little bit, but it was where you actively kind of bring attention to like either a positive or a negative aspect or behavior that the client, or even that the client can press pause on the conversation on what the counselor is saying, to kind of really allow that two-way communication stream and real collaboration.
Mm-hmm.
And like I feel like kind of putting that with obtaining consent, and like putting that skill and putting that as like in front of everything, being like this is what you can do as well in case I do anything wrong. I feel like it's like a really welcoming.
Yeah, or even if they like the
Comforting.
client needs a minute or needs clarification or wants to like, it puts a lot of power in the client's hand, which it should, this therapeutic process should be both client and counselor like kind of working together as fellow travelers, like
Mhm.
as a team. And so I like it. I like the idea of, especially because I think like putting it forward too in like the informed consent is beneficial, because I know like I've had experiences in therapy where I've had like a therapist do this like method of like putting pause on when I'm like talking about something or going in, and to me we had no informed consent beforehand, so to me it kind of felt almost dismissive because I wasn't expecting it.
Mm-hmm.
So I really like the idea of like putting it like up there on the table like first, so that they like can expect it and they can also know that they have that ability as well.
Yeah.
They can always correct the counselor also if they're wrong, and I feel like that is a really good way. If there ever is like repairing a rupture, they're really like, they feel comfortable doing it and not holding back and then like ruining the therapeutic relationship. So
and I could even be wrong about this, but I feel like it could even be like a universal skill for across many different kinds of theories, the
Mhm.
press-pause one, because I feel like that's like almost like a really good kind of, well, it depends because some of them have like different shifts in like power and even authority. Some of them play with authority a little bit more. I feel like this one could be like a good skill to use for a lot of different theories and just kind of having
Definitely like be like integrated into like other like theories and ideas for sure.
Mm-hmm.
It's a good like technique for like building that therapeutic relationship and that trust.
Yeah, and giving the client a little bit more just autonomy and just, I don't know, maybe comfort.
Yeah.
But yeah, I don't know, that's something that came to mind for me. And then to kind of end things off for this section, I just wanted to kind of bring up the flexibility of ACT. And I know you kind of talked about that earlier, about directiveness and how it can, I think that ACT is really kind of unique in the sense where it could be kind of like as direct and as collaborative as something like CBT, and maybe something a little bit more like non-directive like DBT, and how it kind of flow between the two depending on the needs of the client. And so like something that the book kind of talked about was the directive aspects, is that they usually use those for kind of like more lower functioning clients that need a little bit more guidance, a little bit more help, and that having like a clear agenda at the beginning of each session to kind of let them know, hey, this is what we're working on today, could really prove like useful and beneficial for them. But something like non-directedness can usually be used for like higher functioning clients, where they can kind of bring up the stuff they're wanting to talk about, what they're wanting to work on for that session. And I don't know, I just feel like this kind of act of flexibility kind of really helps. I mean, I feel like it can be a little bit unpredictable on the counselor's part, but it can provide a little bit of, again, autonomy on the client's part.
Yeah, and I think it's almost like that's like reflective of why counseling in itself is like an art form, and a skill is like that unpredictiveness of really not knowing what a session's gonna like turn out like, you know, before you go into it, but being able to adapt and use that flexibility and like use your like skills that you've built over this time and like be able to have that ability to kind of like work with the client and the situation that's at hand.
Yeah, I mean, even the length of therapy with ACT is flexible in that way, where it can work long term, but it can even work for very brief sessions, depending on how directive the counselor wants to be with the client, how receptive the client is to that feeling of directiveness. And that kind of depends on like the presenting problem and the severity of the issues that were experienced by the client and what they kind of what they want their session to look like. I know the author of our book said that like 6 is the most ideal, but that sometimes that she's had clients for like 3 years, and other times it's just like a month. And like, I don't know, I just find that really kind of interesting, that it could really, the term or the phrase, it depends, I feel like is really relevant for ACT. So.
Yeah. I really like what you said about like kind of going back to the directiveness and how it's like dependent on the client's like functioning level. And I think like you said, like if it's the client is higher functioning and has their own insight, you're obviously going to be less directive because they need less direction to go. And I think also that kind of depends on the longevity of the actual like therapy sessions also, but like you said, it really just depends on the client. But yeah, I think that's like worth remembering that aspect. Yeah.
Mm-hmm. Yeah, that's all I got.
Well, that's great. Thank you so much, Angel.
Yeah, go ahead. Thank you for listening to our first episode of ACT on this podcast. Welcome to episode 2 on Cog Talk. My name is Lilly, and I'm here with my partners,
Taya
and Angel.
And today we are gonna dive in more on ACT or ACT, and Taya's gonna start us off.
Yeah, okay, so I'm kind of like covering a lot of different ideas, but they all like kind of form into like the idea behind goals and a little bit into like committed action and things of that aspect. And this might be a little bit of an info dump, so feel free to stop me at any time with comments or anything like that. So I want to kind of highlight something that's very important to ACT that we didn't really mention a lot in the first episode, and that is the idea of workability. And so workability, the definition is kind of like asking the question of, is this behavior helping you build a rich and meaningful life? And so this is like something that is like working, like once we kind of adding on to that, like with a follow-up of, is this behavior like working in the long term? And this is in place of like asking if a behavior is like right or wrong, or like adding that kind of like label to it, or like this correctness to it, and more of just like having this like question of like, how is this like behavior affecting your like day-to-day life? Is it like working for you? And if it's not, let's address it. If it is, you know, then that's good that it is. A lot of these things, like, well, this idea, it is like an overarching idea throughout all of ACT, but it kind of reminds me of aspects within like DBT of having like a dialectic approach, or even like other like aspects that are mentioned in different like theories of like regarding like labeling and things like that. I think it's like, instead of looking at something as like so dichotomous as like right or wrong or black and white, it's more of like, how is this specific behavior, like it's not right or wrong, it's not like correct or incorrect, but how is it working in your lifestyle and like towards like you moving towards your goals and your values, how is it affecting that? So that's just something that I kind of wanted to like highlight, because we will probably go over this term a little bit more. So moving on from there, finding the client's values is a very important part of ACT, as it is like within the Hexaflex. However, it may be challenging, especially early on sessions. There are like a few different approaches that you can like do to kind of like try to find these values if they're not coming up in when they may be giving you a history or outright telling you. And these can like be done through like ideas such as like value cards, when you have like values written on note cards, and then you have the client put them in like what order of like, which is like most important to them versus the least. Or like the bullseye, which is what we did in class, where the client labels important values that are found in like each area of their life, or like behaviors that they are like working towards that value, if that makes sense. It's a lot easier to explain when you have it in front of you, but they are like, it's like a good starting point to work on identifying like what the client's values are and like being able to like move that forward. The reason why we clarify values is like to work towards developing these goals. Goals are very important within ACT, because that is like the committed action area of ACT, and these are very like integral to the ACT process. However, these goals need to be able to maneuver within the ACT process, and like what that means is often clients may come in with an idea of like emotional goals or outcome goals, when instead, while using ACT, you are going to like want to identify behavioral goals. And these goals focus on learning skills and taking action rather than trying to eliminate or control emotions. So before I head into some examples, are there any things you guys want to add in?
I think with the values, okay, so you had two examples. You had the cards, and then it was the bullseye thing. And when we did the bullseye assignment, I felt like, I mean, I had previously done the value cards with my own therapist, and so I like have like that really like, I mean, in my past, that's really helped me like find values. And I think for clients, it can be really helpful to actually go through, what do I actually care about, especially people who have no idea. And then once they know what they value, then they can go into like specific values that they like want to work on, or things that they care about now that are important to them, and then do that second activity. Because I felt like if you don't really know, like if you gave a client that bullseye and they don't really know what they value, I feel like it would be really hard to do the activity.
Yeah, so kind of like compiling these different techniques to work towards more like specificity.
Exactly.
Yeah, I definitely agree, because I do think that the bullseye one would be really good and really effective for someone that like clearly knows what they believe in, because it's asking for beliefs and actions and behaviors that are farther away from what they believe in and ones that are closer to that. So like if you give it to someone who literally doesn't know what they believe in or what they value, like I feel like they're just gonna be like really lost.
Yeah, like where do you start?
Yeah.
Yeah.
So I think that's a really good point to bring up.
I think those are, great things to bring up, and I think, it is like definitely, I agree with you guys. I think that it is like best worked in the certain situations like we talked about last time, of like depending of having that flexibility and like kind of understanding what your client may need or where they're at with their values and beliefs.
Yeah.
Okay, so moving on from there, I'm going to kind of give a couple of examples of emotional goals. I guess just one example. This could be something such as like saying, I want to stop feeling anxious, or I want to be happy. In this case, the ACT counselor's job is to reframe these emotional goals with the information provided from the client's values to become behavioral goals. The technique I like most for this barrier is the Sunday documentary, which we kind of talked about in class, but just as like a reminder, is asking the client if they were to have, after they had like started therapy and they like with their like outcome, they were to have a camera crew come and film them for 7 days and at all times, what would this documentary look like for them, and what would they be doing in it? And like this is just a way to kind of pinpoint more behavioral actions within these with it like that work towards the client's values. So for example, if the client says something along the lines of, I want to be happy, we could use the 7-day documentary to find such goals such as like learning new skills to handle difficult emotions and feelings more effectively, or working on developing relationships with those around you if the client maybe brought up that they see themselves, having intimate relationships with their friends and family, spending more time with friends and family, or, being able to not distress in the ways they have been distressing over certain situations. Another type of goal that can become a barrier is outcome goals. These goals present themselves when a client says such things like, I want to lose weight, or I want to drop 10 pounds, and then, or like on the other side of that, I want to gain 15 pounds of muscle. And then we want to work to reframe this as something along the lines of, the goal is that we're going to do everything possible to get you to improve your health in a way that is compatible and realistic with your life, such as managing relationships with food or exercise. And that kind of gives you more of a starting achievable goal than just an abstract goal that's not really as achievable. A large thing to avoid when it comes to goals is a dead man's goal, but I do prefer our professor's term of a pet rock goal due to the risk that some clients may be dealing with suicidality. These goals are best defined as a goal that a pet rock could do better than a person, such as, I don't want to be anxious anymore. This is something impossible for a human and something only a pet rock could do. I think that that's just kind of important to hone in and make the goal once again achievable and realistic. I want to lightly touch on overt and covert goals before I
Is it
turn
okay
it
if
over.
we talk about the
For sure.
the other goals you were talking about? Because I was also reading about it, and I really like your examples. Like if you want to gain 10 pounds or whatever, I thought that it was. So with outcome goals, you were talking about how that those can hinder a client's kind of what they want to get out of life, and how behavioral goals are more specific and meaningful. And I think that's something that might be if you look at it as a clinician before you go into the session with the client, it would be really helpful to be okay, let's see if the client says anything that they want, and then you can really transfer that into an outcome goal.
Mm-hmm.
And I think that the language of going from, I want to lose 10 pounds to I actually want to go to the gym 3 times a week and do this, and so it's more specific at a specific time. I think that could be a way of living more meaningful and rich life.
Yeah, just trying to reframe that with outcome goals or emotional goals, anything that's kind of broad, being able to reframe it in a way that is just realistic and achievable.
Yeah, exactly. But yeah, I really like how you touched on that.
Awesome. Well, I will continue then. Okay, so overt and covert goals. Overt goals involve observable physical behaviors, things that someone does with their body that others can see. And so an example of this would be if a client's value is health and self-care, their overt goal would be to walk for 20 minutes 3 times this week. And these are clear, measurable, and observable actions, whereas covert goals involve internal psychological actions, things that happen inside the mind. Like a client value might be personal growth, and so the covert goal would be to practice diffusion when self-critical thoughts appear. These subtypes of goals are both used to translate values into meaningful life changes. Behavioral goals focus on learning new skills and taking actions. Overt goals target observable behaviors, and covert goals address internal psychological processes such as mindfulness and acceptance. Together, these goals are guided by workability and values, helping clients move toward a meaningful life while building psychological flexibility rather than trying to eliminate difficult thoughts and emotions. So, is there anything that you guys want to add in about covert and overt goals?
It kind of reminds me about like the living and dead person's goals, how it's like you go from something more vague for like the dead person's goal, and I think we mentioned it earlier on, and also in comparison with the more observable goal that's more detail oriented and specific and measurable, which is helpful for the client to make that shift. And I like how you went over that.
Yeah, I think both of them can be like achievable. It's just making sure that like they are both like kind of like reframed and put into like that like I don't know the word that I'm looking for, but like just I guess achievable stance. I think like when I think of it, I kind of just think of more like outside goals versus inside goals is how I like kind of view it, and like goals are more about like things that like I want to change about what's going internally versus things that I want to change or work on about like my outside behavior.
That makes sense.
Yeah, I view it, but
that's really helpful.
Yeah.
Like the inside and outside. Yeah.
I feel like if we ever wanted to like explain these to a client, I feel like that would be like a really good way to kind of distinguish the two, because overt and covert I feel like can get easily mixed up. But inside and outside I feel like that's a lot more straightforward.
Yeah, I completely agree. But I think that's all I have on this topic. So I will be handing it over to Lily.
Okay, so today I'm going to be talking about creative hopelessness. And it is not about being hopeless about life, but it is the strategy of trying to control, avoid, or get rid of painful thoughts and feelings when that strategy keeps making life worse. It is looking if the client is engaging in experiential avoidance. So for example, a client may say, I have to control how I feel. I have to get rid of the unwanted, unpleasant, and difficult thoughts, feelings, emotions, and memories, and replace them with the good, pleasant, and desirable ones. However, if a client says something like this, it can be problematic, especially when a client is experiencing experiential avoidance. That can correlate with risks of depression, anxiety disorders, long-term disability, work performance, PTSD, addiction, and other psychiatric disorders. And so it's really good for the therapist to help the client look at what they have been doing to escape or control discomfort. And these are called emotional control strategies, or ECS. That includes things like avoidance, distraction, overthinking, shutting down, isolating, substance use, overworking, things like exercise, prayer, or meditation if the main purpose is to avoid unwanted feelings. And so it's important to ask the client this question. Is this behavior working to help you build a rich and meaningful life? So if your emotional control strategies are working to enrich and enhance your life, keep doing them. However, the reality is that most human beings over-rely on emotional control strategies, and when we use them excessively, rigidly, or inappropriately, our quality of life suffers. So I know that's kind of a lot to take in, but I have an example to make it a little bit more understandable. So, do you guys ever go home and watch TV at the end of the day?
Always.
Yeah, it's really nice, right?
Yeah.
Why do you guys do that?
I think, I mean, like, I want to say that it's, like, a way to, like, decompress, but, like, also I don't know if it's just, like, okay, I don't want to deal with anything else, like, I'm ready to just turn my brain off, and that's why? I don't know. Could be a mix of both.
Definitely a mix of both for me.
Yeah. So, it's really important to distinguish as a counselor when you're working with your client. You can say, yeah, watching TV is good for you if you want to unwind and relax and enjoy a good show. So it's good if it's moderate and flexible, if you can turn it off if they need to go do something. But it's not effective when a person watches TV to avoid painful thoughts and feelings. Someone might binge watch for hours to escape anxiety, loneliness, or stress, which may help them short term, because then they don't have to think about it. But in the long term, it can lead to more avoidance, less engagement in life, and neglected responsibilities. So to kind of move towards more of the action stage, a therapist can explore the client's ECS, so their emotional control strategies, and what they do to escape or avoid from painful feelings. And just be really curious and ask the client, how are you feeling when you get home, or any sort of example. That's just the TV example. It could be in a lot of other things, like are they exercising excessively, or binge eating, or with chocolate. That's like a really common thing, like if they're relying on it because it's enjoyable, or if it's like helping them cope or avoid things that can be maladaptive. And so the therapist, kind of like the key takeaway is the therapist helps the client see that their own coping strategies may reduce pain for a moment, but it's costing them the life they want. So the goal is for clients to see for themselves that the struggle to control pain doesn't work. And obviously, you can't say that. You have to let the client figure that out themselves.
Yeah, I feel like hearing that, I just feel called out myself. I'm not even in a session, but it feels like, oh yeah, that's what I do.
Yeah, that sounds similar.
Yeah,
Yeah.
exactly.
I mean, that's why I said that example, because I do the same thing with TV. I mean, it is relaxing, but to a certain point, especially if you're binging a show, it's so good, but you're like, I don't want to turn it off, but also I don't want to deal with other things that I need to deal with.
100% know that it's like now I think being in this program, it's even become more of a conscious choice to actively avoid things, because I know it'll provide that short-term like relief of, it's like, oh, I just had a really rough day, I got a lot on my mind, and it's like, instead of doing anything, I'm gonna watch TikTok for an hour and not have to think or talk to my husband about the things I'm feeling. I just want to avoid it all.
Yeah, and I think it can be good at first, because you're like, if you had a really hard day, you come home, you don't want to deal with all that stuff you just dealt with for like 8 hours or however long it was. But also, it's really important to like you have that decompression, but then there's a point, I think. And people can tell where that point is, where you keep going and then it's not healthy, or depends on the person. Yeah.
I guess like balance in all things, but
But yeah.
I don't know, for me, because it's like, if I'm aware that I am choosing to avoid it, I'm like, hey, like at least I'm aware of it, I'm not oblivious to it, and that like justifies it to me a little bit more, even though it's not helpful at all.
I think that is like a better, it's like giving yourself a little bit of like I don't know, maybe this is like bad. I feel like you're giving yourself like some like acceptance and compassion of like recognizing it, because I feel like I tend to do the opposite when I notice it. It's like I am actively choosing to avoid or repress these feelings and these thoughts, and I don't care that it's going to be bad for me, and it's already bad, so why not make it worse? Like I tend to spiral the opposite way of like being like, I don't care, I'm going to make everything worse, rather than like coming. So I think it's kind of good to come at it from a form of like self-acceptance and compassion, but don't take my word. I'm not
I think that's an important piece, though.
Yeah.
But yeah. I think the awareness, though, is definitely helpful.
Yeah. I mean, you have to be like somewhat aware to be able to make those changes. Yeah.
Yeah, and those conscious decisions. Yeah. Well, that's all I have.
Yeah? Okay. Cool. Are you guys ready for a really weird section?
Sure.
Yeah. Have you guys heard of Self as Context?
Yes.
Just the title.
Just the title? It is weird. It is, our book even says that it's like one of the most complicated things to not only understand, but to explain to someone else. So, I'll try my best, because it is really weird. So, Self as Context is kind of labeled as like this thing called the noticing self. It is like the observing perspective behind all experiences, emotions, and thoughts. and it's the part of us that notices those things. And it's the point of understanding self as context is to stay consistent, is to be aware of one aspect of ourself that is consistent throughout everything, throughout changes in age and behaviors and emotions and experiences, that there's always one part of you that's going to stay the same, and that is the part that notices those things. I know that sounds a little weird, but there's one metaphor that helped me kind of understand this concept a little bit more, and it was the sky metaphor. So it is that, to kind of visualize it, it is the thoughts are like clouds, feelings are like weather, such as like storms, rain, sunshine, all those things. And then self as context is the sky itself, that it is always there, no matter how many clouds or the weather that's going on. And it's to kind of reiterate that we are not the storm of our thoughts and feelings, and we are the space that can notice them.
Huh.
Does that make sense?
Yeah.
Yeah. What are your guys' like initial like impressions of that?
I really like the idea of it. I think like abstractly, when I'm not practicing myself, I'm like, that's so great, that's so empowering. But then like when I try to like think about it myself, it's a lot hard, easier said than done.
Yeah.
But I really like the idea of it.
Yeah, it's interesting, to say the least, for me.
I like how it's a picture, and also I think because it's like a picture, you could like draw it.
Mm-hmm.
You could like do colors, you could like put your like thoughts or clouds, you can draw clouds and put your thoughts in the clouds. Like I think that's a really good visual. Or like feelings are like weather, like depending on how you're feeling, like if it's rain or shine, it's like
I think that's like
positive
the
and
example that I've liked the most is
Yeah.
like the weather of like you yourself are not this rain, you're just experiencing this rain, and like using that as like the self as context, and like kind of like this diffusion between what's going on internally and who you are and what your values are.
Mhm.
But I think like for me that's like the easiest way to picture it is the weather example.
Yeah, definitely. And the self as concept is the sky itself. I mean, that can be like, it's like air, it's like space. And so it's, I don't know, you have like this space with like feelings and thoughts moving through it. And I think that's really helpful for when we like take thoughts and feelings outside of ourselves and look at it in a different way. I think that's helpful.
I think it's interesting that you just said space, because self as context is like meant to provide that like a psychological distance between the self and the emotions, and give the client like a safe space to really look at themselves apart from their emotions and their experiences. And like another way to kind of help teach this is like the talking and listening method. So that's like for like a certain amount of time, the client just has to listen to what the mind is saying. Just kind of let thoughts kind of go on continuously. And then if they stop, just keep listening until they start up again. And then this, like, it almost like forcefully brings out the noticing self, and to the eyes of the client to see that that thoughts just come and go, and they are not solidified and concrete, if that makes sense.
Yeah, no, I think that's like perfectly described as kind of like the like changing of it all, like very like transient and not just like not one with like who you are. Like you're not an angry person, you're feeling angry.
Yeah.
In the moment.
I like that. And just so you know, I'm presenting the self as context stuff here in a couple of minutes, and I had something else very similar to that. So when I say it, please don't think that I stole your idea.
No, it's all good. I stole that idea from years and years and years ago as an example in a class, so it's not. I didn't. Come up with it.
Okay, cool. And then another one is they call it the continuous you. So it's like you repeat instructions. So it's like notice X. Think of like anxiety. Like notice anxiety. There is anxiety, and there is a part of you that is noticing anxiety. And if you can notice anxiety, you are not anxiety. All right, and then continuing on with the continuous you, I think our example was anxiety. So if anxiety is a part of you, there's much more to you aside from anxiety. And finally, if anxiety changes, the part of you noticing anxiety does not change. So the whole point of like the continuous you exercise is to kind of help clients like diffuse from certain thoughts and emotions, which is one of the biggest goals of ACT. And then kind of ending things off, we have why ACT uses self as context. This idea kind of helps with psychological flexibility, again, one of the main goals of ACT. So when people get stuck in their thoughts, fusion happens, and then kind of noticing the parts that notices everything kind of creates like that psychological distance, a little safe space to kind of start the process of diffusion. And self-awareness of self as context can also create, like I said, the psychological distance to kind of just help view that emotions, thoughts are just there, but not necessarily attached to the person themselves. I know it's a lot, but do you guys have any like questions or thoughts about how self as context in general kind of is?
I think that you explained it pretty well. I mean, I don't really know if I can think of anything off the top of my head.
I really like the psychological distance piece and like how you were talking about weather before and just kind of creating that space. I think that's kind of one of the things that before I even knew anything about ACT, before we started our podcast, that's like the only thing that I knew about it. And I think that's like one of the main things that clients might like ask for or might mention if they're a little bit familiar with it. And so I think like talking about how our thoughts, our clouds, and our feelings can be like the weather and how that can create distance from ourselves as the sky. So yeah, I think like explaining that to clients in that way is really good.
Yeah, absolutely. And then finally, like why we as counselors can teach this. So it can, again, just kind of bring awareness and reduce like over-identification with thoughts. It's a process that could be used to like handle painful emotions, build mindfulness. I feel like you need to practice and at least know what mindfulness is before getting to this. And then staying connected with true values and beliefs and a consistent like sense of self, and then help teaching that thoughts come and go, and again, we are not those. And that our identities and stories change over time, and it helps clients realize that they are more than the thoughts or emotions that they experience. So the only thing about self as context for me is that as a student, viewing it and learning about it is difficult because it's very abstract. So the thing I'm worried about is if I want to utilize this, how to use it in a practical sense and actually like using it with clients. Because it's not necessary, like you don't have to tell them about self-context and like absolutely bring it to their awareness, but to at least have it like be in the back of their mind could help. But I don't know, like I said, teaching it could be a really difficult thing, and that's kind of what I'm a little hesitant on, I guess.
Yeah, I feel like you kind of have to like integrate it within like the conversation that's flowing instead of like be like, oh, let's read this paper with, you know what I mean? It's kind of just like, oh, this applies to like the circumstance that you're going through or the situation. I feel like that might be more natural. I don't know what you think about that.
Yeah, it's, I mean, I do think kind of building a plan surrounding mindfulness to kind of ease it into it would be helpful, but
yeah, I think it kind of needs to be like something that's more consistently like a consistent ideal like throughout like the process of therapy, of kind of like falling back on like it as like a skill, if that makes sense. And like maybe even I think that with the introduction of it, like doing self as context, like homework assignments and things like that, so they can actually practice it throughout the weeks, and then trying to integrate that in maybe with whatever presenting concerns are coming up throughout like the term of like your like therapeutic relationship that you have with them, like throughout the entire like term that you have with them.
Yeah.
I did want to mention from just you discussing the mindfulness and like the necessity for it. It kind of reminded me, and this is a little bit of a tangent, but it kind of reminded me about like trauma counseling and how, and like crisis counseling. And I think that ACT could be very beneficial in a lot of those cases, due to like the, I mean, if you're looking to like stabilize a client before necessarily moving into like processing, I think that like that's where you can implement a lot of like mindfulness techniques to like help with stabilization, and then integrate. I mean, within ACT, the idea is that there's a lot of like flexibility, right? So you don't have to necessarily go through each of the stages or each of the like ideas in a certain order, but I think like helping with like if you're working with a client in crisis or trauma, starting with the stabilization process and like using like a lot of the mindfulness techniques, and then slowly moving into the processing with the other ideas that are mentioned throughout the hexaplex, I think can be very beneficial to a client in that situation. So that's kind of like what it just reminded me of when you talked about like the necessity of building that first.
Yeah.
Yeah, and also like if you like bring a client into the mindfulness space and like they can ground and slow down, I feel like they're more open-minded to like other terms of psychological flexibility in general.
Yeah.
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 That's all I got for
Okay.
self-contest, yeah.
Yeah, so just to kind of wrap up, I mean, we're going to see clients really soon.
Yeah.
Like,
Yeah,
this
no.
is coming up.
It is.
And so, as counselors, we often avoid doing important aspects and elements of ACT because of our own hard barriers. So, HARD is an acronym saying for hooked. So, we get hooked and say or think that we can't do it, it won't work, or the client will act negatively. The A in HARD is avoid or avoidance. We avoid the discomfort by experimenting with new tools, techniques, procedures, and processes. R is remote. We become remote from our values as a therapist and therefore unwilling to leave our comfort zone and try new things. And we set doubtful. So D is for doubtful. We set doubtful goals for ourselves as to when, where, and how much we will bring into ACT into our work. So once again, a reminder, we must apply ACT to ourselves if we wish to do it with others. So I don't know if you guys are going to actually like implement this in your, like if you resonate with ACT, if you want to implement it with your our future clients in just like a few weeks.
I don't really say that.
But it's just kind of important to remember that if we want to do, I mean, and this goes for, I think, for every theory or anything we want to implement, like if the client is going through something, or if you want to, if you want to use ACT, you have to try it on yourself and really do the work with yourself. And I think it would just make a lot more of a high quality therapeutic relationship. So
Yeah, I think that's very well put.
Yeah. So when our clients resist making behavioral changes, most of us tend to get frustrated or irritated, doubt our own abilities, blame the client, blame ourselves, or blame the ACT model. While this is normal, it isn't particularly helpful. A better alternative is to simply apply ACT to the issue itself. So another way to put this is whenever a client is stuck or is kind of resistant to something, the first step, like what we were talking about, is to look at things mindfully and look at what's happening and be really open and curious to what the client is going through. I think that would be beneficial. Is there anything you guys can think of if like a client is resistant, like what you would do just in general?
I think that bringing maybe like some awareness to the resistance and kind of like using like some immediacy skills to bring it kind of into attention, and rather asking like why they're doing a certain behavior, or necessarily like maybe more of like the need behind it, and if they're like aware of it and things like that, I think can be beneficial. I don't know how necessarily that might like perfectly align with ACT, but I think that's like my first instinct.
Yeah, definitely.
For me, I'd say, I don't know, I kind of like to embrace like the collaborative aspect of it and kind of get some more feedback from the client themselves and be like, well, like what do you think would work for yourself? Like what do you want to do, or what about this do you not like? Because I don't know how I feel about just using one theory entirely. I feel like I'm taking a lot more of like an integrative approach, or I'm taking like bits and pieces of ones that I think that could like flow well together, or it's like techniques based or whatever, and then kind of seeing how the client is like receptive to maybe like they like the structure of CBT but not the homework aspect of it, something like that, and kind of seeing like which parts they like and which parts they don't, kind of build a much more like personal approach for it.
Yeah, I think if you were to look at it from like, now that I've had a minute to like think about it from like an ACT perspective, I think you would maybe want to highlight maybe like bringing it to the awareness of the client and kind of look at that through like the choice point, and maybe start to question like the workability of the resistance and how that is maybe affecting where they're wanting to go with their actions. So I think that's like also an option as well.
Absolutely.
Yeah, the workability and then also the collaborative piece, I think, really resonate with ACT, and also just I think with every theory, just be non-judgmental. Like it's just that feels so good for the client. So, and the more you apply ACT to yourself, like we said, the better you'll be able to do it with others. And the reverse is also true. If you aren't using it on yourself, you won't do it well with others. So, well, is there any last minute thoughts we want to talk about before we wrap up?
I
think we've covered it all.
Yeah. Thank you for listening to our podcast. Yeah.
This is our last episode of Cog Talk. Thank you for listening.